We're learning more about the Butte-Glenn Sexual Assault Response Team's 2026 report on sexual violence between 2022 and 2024. And Action News Now reporter Sade Pullen joins us now here with a look at what's driving the numbers specifically for students in our area.
Yes, Alan. So I spoke with a forensic nurse examiner with Enloe Hospital, and she said that the most vulnerable age that comes with the risk for sexual violence is between the ages of 19 and 24. Now, Jacqueline Winters Hall, a forensic nurse at Enloe Health, tells me that a forensic exam is done to document injuries, provide medical care, and collect evidence following a sexual assault and domestic and child abuse. While the report covers incidents in Butte and Glenn County, all the patient reports were taken at two major hospitals that handle these cases, Enloe Medical Center and Orville Hospital, since Glenn Medical Center did not have a forensic team when it was operating, and now it's shut down altogether due to a change in federal funding. Winter Halls tells me that among the victims, 49% were students. This includes grades K through 12, with 61% in college, primarily at Chico State. She says at least 68% of victims knew their assailant. Substance use was noted before the assault, with 50% reporting voluntary alcohol use and 40% reporting drug use. Winter Hall says when alcohol and drugs are involved, people are more vulnerable to sexual violence, but that doesn't mean the victim has done anything wrong.
The risky behavior puts people in higher risk situations, and assailants are predators. I think the recommendation is that predators need to stop being predators. And college students should be able to be college students. The judgment isn't on the victim or the survivor. The judgment needs to be placed directly on the assailant.
Winter Hall says children from elementary and middle school have experienced sexual assault. As for high school, she saw a mixture of students from Pleasant Valley and Chico High. Winter Hall says that the increased number of reported assaults doesn't necessarily reflect an increase in sexual assaults in our region, but rather that more people are feeling safe coming to the hospital to get reports and exams. Now, Winter Hall says if a minor is assaulted and wants an exam, they need parent or guardian's approval. Winter Hall says you can get a forensic exam up to 10 days after the assault, even if you have showered.
Well, so Sade, what is Chico State doing about reported sexual violence against students?
Yeah, so I reached out to their public information officer for Chico State, Andrew Staples. He says that the university takes comprehensive approach to prevention and response through mandatory and ongoing Title IX and sexual misconduct education for students, faculty, and staff. They also work with Wellcat Safe Place, where students can get support and help with a formal report.
Very interesting and concerning as well, but thanks, Sade. Now, you can find the full report and full statement from Chico State's statement as part of this story on our Action News Now homepage. Potential